Hello, my name is Dr. Rakak Alabioshu, and I'm the chiropractic physician at Align Modern Health Deerfield. Today we're talking about the injury before the injury. And the condition that we're going to be talking about is IT band syndrome. Now, a lot of people know IT band syndrome associated with pain along the lateral aspect of the knee. And so a lot of people will experience a stinging sensation, they'll experience a burning sensation, pain in the beginning of their runs, pain at the end of their runs, every time they flex the knee. What we want to talk about is what we can do to prevent that sensation from occurring and how we could possibly help in treating it to prevent further damage. So one of the things that we want to make sure we do before we run is to warm up. A lot of runners will use running as a warm-up, and that's not an adequate way of warming up your hips. Some of the basic stretches that you can do to begin is a basic hip swing. I like to just use a pole or a wall and essentially kind of open the hips back and forth like this. And you could do about a set of 10 to 15 to kind of get those hips moving and activated. Another active warm-up for the hips are monster walks. And with these, we're actually going to do them stationary. This is a great exercise because what it does is it helps to engage the lateral aspect of the hips. A lot of times when we run, we focus on one plane of motion, and so we want to make sure we have good balance. What you want to do is you want to have your feet shoulder width apart, okay, chest up nice and tall, and then we're going to drop into a basic squat position, okay? We want to make sure that we're not rounded through the mid-back, that we're not arching too much through the low back. You should feel no pain or discomfort with this. And from here, what we're going to do is just create a little shift back and forth with both legs. And what we're doing is we're getting these hips to fire. This is a great warm-up for the beginning of your run. Another thing that we can do post-run is rolling up the IT band. Now with this one, I know a lot of people know of this exercise. A lot of people have a tendency to kind of just roll up and down and up and down. But what we actually want to do is we want to do more of a pin and stretch, okay? So what I like to do is make sure that bottom leg is straight. The top leg is going to essentially be that supporting anchor, and we're going to push along the floor so we can go up and down that IT band. And essentially what you're going to do is you're going to roll. As you feel a point that becomes very tender, we're going to hold that point, and then we're going to bend the knee back and forth right through here to work right through that IT band. Hopefully you learned a couple of things that you can do pre and post run to help prevent some of the discomfort that may be associated with IT band syndrome. If you are experiencing any of these type of symptoms, schedule a complimentary sports screening assessment here at Align Modern Health.